Here at University Radiology Group, we offer a wide range of services for the patients, from routine screenings to more complex imaging. The scope of specialists we collaborate with is extensive.
Our organization is across 11 hospitals, 25 offices, and counting. We are planning on opening even more private imaging centers in New Jersey. When we look at the strategic planning on when we place the open MRIs, they're often in areas where there are no other open MRIs. When we place them, our return on investment is almost instant. We really have no trouble getting the schedule to be maxed out.
When we put in the velocity, things really changed, and it was like turning on the lights. Our radiologists felt much more at ease reading these cases, and we're able to make more actionable findings and diagnoses, which also translates into a greater referral base for our providers, because they feel comfortable with our readings, and the fact that you can scan faster, the fact that patients tolerate it better, the fact that there's decreased motion and an excellent resolution means that operationally there's lots of efficiencies. One of URG's missions is to really reach out to the community and impact care. And what we want to do is offer imaging that is accessible. And the 1.2 Tesla allows for the pediatric patient to feel comfortable in the open setting, allows for the claustrophobic patient who is highly anxious not to get medications or have to have conscious sedation. It allows for the bariatric patient who may otherwise not be able to get onto a table, be able to fit into the open MRI. And ultimately, what that builds is brand loyalty and customer loyalty. This open MRI has really been transformational for our practice and for patients.
We have two magnets here, one being a 3T, one a 1.2. And the good thing about having two magnets side by side is a lot of times when we usually have a patient on a magnet that they are not able to tolerate, we are able to stagger our schedule and accommodate the patient basically on the one that they are more comfortable with. It really helps us with making sure that the patient completes their exam, they are not rescheduled.
Overall, it makes our jobs much easier when the patient's at ease and we can get them in and out of the machine. I mean, overall, there's so many patients that we've had come through that wouldn't necessarily have an MRI at all if they couldn't go on the open. We see very claustrophobic patients, but by the end of the exam, they're usually happy and saying thank you for such a good experience. We try our best to make it as easy as possible on the patient. And that ultimately leads to better patient satisfaction and better care for the patient.
From the radiologist perspective, and I'm a practicing radiologist and I look at these images every week, it's really amazing what you can see and what the magnet can do. The high signal to noise, the AI that's built in, including the deep learning reconstruction feature, allows for images that are really quite beautiful when you compare them to closed magnet. I look at patients who have tinnitus and vertigo, I look at patients who have disc herniations, I look at patients who have multiple sclerosis, and that's a lot of the bread and butter work that we do on the 1.2. So those types of patients require really fine and detailed imaging, and we've seen that with the 1.2, it's just as comparable as the 1.5 or even the 3. You can see the fine nerve roots of the 7th cranial nerve. You can see the MS plaques in and around the corpus callosum and the ventricles. You can see really small disc herniations that are causing radiculopathy or a foot drop. So the imaging has been really excellent.
On MRIs that are on small parts or on organs that are not in the center of that bore, the 1.2 velocity open MRI does better than even 1.5T and 3T applications. The reason for that is it's a very homogeneous field. And so what ends up happening is that we don't get the artifacts that we get on this open MRI that we might get on the other ones.
One feature of the velocity that makes my life easier is we are able to off-center the patient when we're doing extremities. The ability to off-center the table allows us to keep the patient lying on their back. They don't have to lay on their chest, so we can off-center it to get the patient's body part in isocenter. It results in less scan time, less repeats, and better quality images for the patient.
So we offer MR orthograms, and they are not offered everywhere. With the open MRI, it actually gives our techs and our patients the confidence to get the exam completed within a certain time frame, because it's a very time-sensitive exam. images have to be captured at the right window before the contrast escapes the joints. So this actually becomes very crucial. So with the open MRI, patients are able to tolerate that, knowing that, they're not going to be less claustrophobic.
The training process was efficient, and overall it was very inclusive. Everyone on the team felt very comfortable with the software and how to use it. After a short while, we were ready to scan. What's great about the Velocity system is that we've had very minimal downtime and very minimal maintenance needed. We call the helpline probably maybe once or twice a month for various things, ways on how to make images better or to clean up a protocol here or there. It's easy to contact them, and usually within an hour or two we'll be on the phone with them to help us out.
So a partnership with Fuji is something that other groups should highly consider. The equipment, first of all, allows for versatility, better patient care. And finally, Fuji has been here for us from the beginning. Anytime we have a problem or an issue or need to bounce ideas off of Fuji or need some kind of new development, Fuji's always willing to listen and deliver. And I think that kind of partnership is invaluable.